Look at these two girls. One of them is, this is a no medication. This is a blackest medication. This is the range of okay in the test, the TOBA that we're doing. So when she was 9, if she took the test with no medication, she did really off. But on medication, she was doing great. After the years passed by, 2.5 years later, she started doing better and better. And remember, I told you there is a lot of retest reliability, so you don't get used to the test. And then in the end, she grew out of the attention deficit. And you see 50% of the kids do that. Probably it's less, but the number is less than 50. I think some of them appears to grow out of it, but inside is still, but you could say at least 40% they grew out of it. And she's one of them. But now look at this other girl. This is another girl now, and she never did. No matter when you tested, on medication, she does great. Without medication, not good. So she's gonna be one of the adults, ADHD, one day. You know? So I want to bring out the attention now, but I want to bring the attention to two cases. One of them is caffeine, and another one is nicotine. So in caffeine is a stimulant. I always said it's like two mice trying to fight and get into the same hole. Caffeine and the medication. So don't mix them. Harder on your heart. Caffeine reduces blood to your brain. Caffeine is, I told you there was a double-edged sword. So in the energy, that's what everybody drinking to get an energy. Don't do it, because it gives you energy today to make you tired tomorrow. It's robbing Peter to pay Paul. That's what I propose always, the caffeinated people. I'm one of them, and all my patients, hopefully they are. And that's the first thing I always pound. Even my staff now follow after a while with that. So this lady did not tell that she took caffeine, and then we know historically this lady, 2 cups of coffee makes her already jittery. So she's very sensitive. And then she comes to the test. Let's stay on line 1 to avoid getting complicated. So line 1, the variability of reaction time, like the one we measured in the medical student, right? So she's a very ADHD, and she comes in, and no medication, she did okay, not good, not bad. That's not her, because she's really ADHD. So then she took medication, and she did actually worse. So what happened? Upon the puzzle results, she confessed, I just drank a cup of coffee. So she come back 2 weeks later without any coffee to avoid to do the test on withdrawals of the caffeine. So no longer withdrawals, she comes in, she does the test on no medication, and she scored the way she truly is. Now the test is reflecting who clinically you see that she is 73. Now look at this. She only needed 1.25 milligram, not 25, 1.25 milligram to rate it a good solid 114. So you could say the caffeine was fighting this, making it worse. You could also say the curve, maybe it was too much medication. Remember, 2 cups of coffee makes her very jittery. Maybe this lady is one of those in the curve, they only need a little hair. But a little hair, indeed, only 1 milligram. I have one nurse that she takes only 1 milligram of Adderall, 1 milligram. And that's all she does great. So she could be like this lady. This other young man is an issue with the smoking. As you can tell, he smoked 2 packs a day. So prior to this test, he was smoking, I think it was like 5 or 6 cigarettes. I think so, 5 or 6 prior to the test. Then he did the test. And he's very ADHD. So the test did not reflect who he is. And then he came not smoking. This one should have been weighted, because now he did very low. This below 40, that's really low. It could have been also the withdrawal from the nicotine, but definitely you see how smoking, the nicotine covered for that self-medication. So this is the result when I read it with patients. The parents, for example, the adults come in, and I tell, it's very neat, because then you tell them, this is the norm, anything below is not. This is the variability of the RT, which means response time. So how the response time change. This is the speed that you had. Every column is 5 minutes, the first cue. The H's and the T's is just the summaries. So the first 4. This is the impulsivity. After 5 minutes and 10 minutes, you start getting impulse here. you start getting after, well, from the get-go, you borderline here, your brain is all over, and here too, and then here, the more the time passes by, the worse you're doing. So it's very nice for the patient and for the clinician to see exactly, it's like these are the numbers correlated with that, to see the photocopy of what they're doing, and they like to see that. So another benefit in kids is that I like to suggest after a couple of years to do that again, so to compare. And sometimes we see, what if this kid is like the girl that grew out of it? So let's give him a chance to every 2 years, like in summer, I tell them get them off medication if they can. Some kids are very angry without it, but a lot of kids take it only for the school. So I tell them don't give the medication and come back and let's do the test to compare. Are we getting out of it? And this is the distractibility, one more measure of the test where they measure the amount of errors that you make by not paying attention. And then in here, finally, this is the sixth variable of the test, is the standard deviation. If you know, the standard deviation is a curve, right? So if we measure everybody, all the tall people and little people, they are in the end. And most of us, if we measure weight, we are in the curve. So anything in the end is bad. So one of the ends for that is minus 1.8, a standard deviation. So anything below that, but bigger than that, higher number in the negative is worse. I have patients from this amount to all the way, I call them my gold medals, minus 20, minus 21. I got the physician that I told you, one of them, he has a very responsibility in town. He was minus 21. And he pays in the office saying, how come I'm so dumb? I can't believe this. I said, yeah, I told him, you know you're not dumb. It's just attention deficit. He's intelligent. But he was minus 21 standard deviation. So, in case you see a lot of errors, could be also another issue. I got a police officer that when you analyze the errors, the ADHD was horrible, the test. But when you look at the data, all the mistakes happen in chunks. And the rest of the time he did great. And he had also a sleep apnea. So he fell to sleep in the test. They wake up, keep doing well, fell up. So treating the sleep apnea left him with a very mild ADHD that required no medication. He only needed the CPAP at night. So that's why we need to see everything. And I don't want to continue. I mean, they're doing more, but there is the norm. At least you got 90% capacity to detect who doesn't have it, you know, and the capacity to detect who has it. So these are the numbers that they're very significantly high for a test. Tests in medicine don't have a lot of percentage. So being in the 80s and in the 90s is a good for a test. So that's it. Now let's talk quickly about the treatment. I anticipated and I told you how the medication works anyway, so that makes it easy to finish this part. Suggestions. A lot of these suggestions, you know, the teacher-student ratio is important to sit in front of the class. It's stimulating. Now that we know they have the traffic jam, let's get stimulated so the back door connected with the class and what they're doing. Also, the schedule most demanding task to do it in the morning, not in the afternoon. You know, so timing the medication. I do that all the time. Sometimes, actually, I give him the stimulant medication, long-acting, in the morning and a little bit of boost in the afternoon. And sometimes this different. I got few kids that somehow, for some type of the metabolism, the long-acting doesn't kick in until later. So I give him a fast-acting in the morning, teeny tiny, 2.5 milligram, sometimes 5 milligram, that's it. And then the school nurse, I tell him to give him the Vyvanse at 10 o'clock, and it works well. So we can do a lot of different experimentations. To the adults that don't respond to the regular things, I give them 5 milligram tablet. And they can take 4 or 5 a day, but do the math. Even 4 or 5 is just 25 milligrams. I see this adult coming to my office taking 100 milligrams. And I don't do that. So let's talk little and often is better than that kind of barbaric amount. And a lot of suggestions here, busy slides. So some of them, you know, the direction, the way you work with them, the stimulating, you know, these are things that if you like, well, you have the slides with you, so if you wanted to do that, you can. the studies, this one is it's a little bit old now, but it's very important. It shows that the medication actually is not being done, contrary to the narrative that is they're bad for you, and that's not true. The stimulants are the best known Center for Control Disease. This is new now. See, they got the best known widely used treatment. Between 70 and 80% of children respond positively, and they are very conservative in what they say. It's more than 80%. But I mean, I mentioned that again just to remind you that we are in a good position, good state. At least people recognize that. And in reality, stimulants is the first line. The study have shown that therapy is very important, of course, to the parents and to the kids and the adults. But they need the medication. Prefrontal, I already told you that in my own way, about the issue of the dopamine. So when you see alpha, you see that thing. If I want to tell you something interesting, alpha is a receptor in the brain. They have two receptors. One is alpha 1 and alpha 2. Alpha 2 makes everything intense, sympathetic outflow, womb. Alpha 2 manage alpha 1, so alpha 1 is relaxed. So like a soldier with PTSD, with dreaming at night, a lot of alpha 1, you give him an alpha 2 increaser and calm the alpha 1. So the famous Intunif medication that you hear around is an alpha 2 enhancer, clonidine. It's an alpha 2 enhancer. Also lower the blood pressure, because if you calm alpha 1, the vessels go like this, so the blood pressure goes down, so you need to be careful. But they also help indirectly. So they're good like an add-on, and long-acting is preferable. And now I go to this slide. I like the Vyvanse, that's what I put them in red. It's Adderall connected to the protein molecule. So when you take in your stomach, the stomach takes a while to digest the protein connected to the Adderall, relieving the Adderall out into your blood. So actually, it's a natural delivery. And when you see a kid or an adult taking, let's say, 30 milligrams of Vyvanse, he's only taking truly 5 milligrams of medication. While if you take 30 milligrams of Adderall plain, you're taking 30 milligrams of a stimulant. But in Vyvanse, even the 70 milligram tablet don't get to be 30 milligrams. Most of that capsule that says 70 is mostly protein. So to me, it's my number one. I think we have now more than 3,000 patients for attention deficit, and maybe I have maybe 200-300 in other things than Vyvanse. Most of Vyvanse has been that made by Shire. It's the best. Concerta has gone far away from me. I don't do the famous Focaline that you see about a primary care physician. I don't think it have the punch, and it would phase away. And remember, the key for treatment is to have a little bit all the time. If you can drill the brain and put a little drop every 5 minutes, that would be the best way to treat it with the least amount of medication. The closest that we have to that is Vyvanse. Quilivan is the Concerta. There's only two families, if you want to know about that. The family of the Adderall and the family of the methylphenidate, the famous or infamous Ritalin. So the Ritalin family is all these guys. It becomes in a patch, now comes in a liquid, and comes the Concerta. There is like a little syringe pill that when the kid takes it, the body gets, fluid gets in one end, and they push the medication. Sometimes they poop the little empty shell at the end, the kids. Do we really, it's a good man. I like the Concerta, but the advantage and the success with this guy is so big that everybody else has been really gone to a second place. And another advantage of this Vyvanse, since it has a protein in it, you can get the capsule, open it, and put them in a bottle of water, shake it, and you drink half now, half later. I got other guys like working in banks. I got 2 or 3. They sip it all day like a tea of Vyvanse. And you know you're not taking much. It's a fixed dose. They crack in the morning. But that allows sometimes a college student, I tell it, get your dose, put them in a glass of water or the bottle, stir it, drink it whenever, and save a little bit for 5 p.m. At that time, you need to study late, but to me, is 6 to 8, 6 to 9. I remember I'm big in the sleep. So I tell them, take it at 5, a little shot of the Vyvanse. That will be equivalent maybe 2 or 3 milligrams, really. And they take it, and it works very well. Like I told you four or five slides before, timing the medication to the personal life of the individual is crucial in attention deficit. It's about time. And I told you already about the alpha-2 agonists. I jumped the gun on that one. I told you already that's in Tuni, 10X, one facility, the same thing. They're very good. I should have put here clonidine too, but it's a little harsher. I use these, which they're mellower. Shire also made that one. Strattera, I told you already, increased the norepinephrine. I would say it's a 30% benefit. This is for when you have narcolepsy. They give you energy. Very nice medication. Over the counter in the rest of the world, super mega tight, restricted in America for unclear reason. If you are in Canada, you can buy it along with an Alka-Seltzer. In here, oh, you die if you buy it without doctor prescription. But go figure. It's a very simple. You see the Benadryl that you take for allergies. Provigil is the anti-Benadryl. It's the opposite of Benadryl. Benadryl blocks the histaminic. Provigil increases histaminic. Antidepressant, I rarely use that for attention deficit, even less Wellbutrin. The primary cares, they liked it, but to me, I feel that it gives a lot of anxiety to the patients. Natural supplements, they're very important. I think the king of them all is this guy, Fofadidil-serine. Nowadays, there's some company are mixing these two and making a prescription drug supplement for kids. I recommend this for everybody. Even if you don't have attention deficit, increase your memory to every regular folks. And I love this life extension. I used to sell it in my office in California. I haven't done it here, but it's wonderful. Ashwagandha is very good, comes from India in a plant, and increase memory. Green tea, decaffeinated, in capital letters. It's, yeah. You know what? Good idea. I'm going to do that next time. Ginkgo is very good also from the leaf, and CoQ10. But if you're going to go CoQ10 for energy, for your heart, as everybody should take it. I take CoQ10. It's very important, and antioxidant. Buy the ubiquinol. It's the one that penetrates in your body. And behavioral parent training is so important. You train the parents before you train the kids. The classroom management, the 504, you're probably all familiar, group training. And so remember, if somebody has that, 20% chances that you have it. Same thing with the parents, 60%.